pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Jeff Murphy will be joining us via Zoom this evening. So moving right on to any additions to the agenda.
I would recommend that you consider employment for Girard Middle School assistant volleyball coach. Just due to some numbers, we need some help. And that would be 20B, agenda item 20B.
I have a motion to approve an addition to the agenda for 20B.
So moved. Second.
Moved by Peggy, second by Dave. All in favor say aye. Opposed, same sign. I would also like to entertain a motion to approve the agenda and consent items.
Second.
Moved by Kelly, second by Roger, to approve the agenda and consent items, which include board agenda items numbers 3 through 6. All in favor say aye.
Aye.
Opposed, same sign. Approval of the board agenda and consent items carried.
We would like to move agenda item 9 up, just because we want to introduce our new teachers. Some of them have some school obligations yet tonight, so we want to get them out of here if they can. But we do want to introduce them so we can put a name to a face. And very excited with the group we have, and I'm going to let building principals do that. If you want to stand up and say something and tell us where you're from, you can. If you don't, that's okay too.
First, we have Heather Flanagan, if you want to stand up. Heather is coming to us from Miami, Oklahoma, and she's in 4th grade, so thank you for being with us. We also have Heather Culbertson. We're hiring Heathers this year. She's in 5th grade, and she's a Pitt State grad from Gardner, Kansas. This is her first year in education.
We have 2 new people in the high school. Katrina Frobe, our new PE teacher, assistant coaching some things, really doing a great job in there. And then a new old face, Michaela Kugler. She graduated from here a few years ago. She's teaching math, doing a great job. We're excited to have them both here.
Hi. We have Sierra Robin right here. She comes to us from Frontenac, and she taught at Frontenac last year. And she's teaching 8th grade English, and we're glad to have her here. We also have Jeff Beatty. I don't think he could make it tonight, but he is teaching 6th and 7th grade social studies, as well as coaching 7th grade football and also boys basketball. And we also have not a new face, but another teacher who came to us from RVH, and that is Kim Curran, and she is teaching 6th and 7th grade English. And so we're happy to have her on board as well.
Thank you.
Next on the agenda is patrons' comments. Again, welcome to all of our guests in the room. If you would like to provide patrons' comments to the board, we ask that you state your name and come up to the podium so that we have information for the board record. We would also ask that you limit your comments to 3 minutes. And just a couple of reminders, per the board policy, the board will not interact or interrupt during your comments unless we have a question for clarification. Also, because this is a public forum, there are privacy rights for both staff and students. So if there's a comment that directly relates to either, we won't be able to discuss it during this time frame. So if we appreciate you keeping to those guidelines, and I'll just open it up if somebody wants to go first, or Mr. Bowden, if you have anything to add.
No.
And I've asked Mr. Bauer to be the timekeeper so that the board can listen to patrons' comments, so.
There's Tony Anderson. I watched the end of the meeting last time on TV, and there were some contradictory statements made by the nurse representing Crawford County Health. Earlier in the meeting, Mrs. Dooling was here and said that they were not out of beds, they were short-staffed. So that means the hospital's not full, and I've checked with a couple other nurses that have been around, and they are not out of beds. They are short-staffed. So that, I'd like for the record to be that they were not out of beds. And then when she was asked about the PCR tests, differentiating from the flu and the other viruses that are going around, the PCR test was discontinued by the CDC. We have nothing else. It will run till December 31st. The reason being is it cannot differentiate between the flu and the coronavirus. And if you look at the numbers over the past years, you know, we usually have 80, sometimes 80,000, 70,000 flu deaths a year. Now, all of a sudden, we're running about 1,800. You know, corona's cured the flu. And that's all I kind of want to correct the record, that I disagree with that.
Can I speak?
Hello everyone, you may not all know me. I'm actually a member of the staff here. I work as a janitor in the high school. I just wanted to come up and comment on the kind of current climate of things in regard to COVID, in regard with the kids going to school en masse 8 hours a day. I want to vehemently stand here and say that I disagree with it wholeheartedly. The reason being is that young people are in the least risk group out of everybody who might be affected by COVID. Last year, you know, from the beginning of the pandemic till now, there was over 400,000 cases of COVID in children. Less than 1% of that number resulted in serious health complications or death for those kids. Obviously, any person who gets sick and winds up in the hospital, it's a tragedy. It's not something we want. But I feel that we're living in an era of fear at this point. We are looking at case numbers very heavily. We're weighting case numbers more heavily than, say, hospitalizations or deaths. I saw a recent study on surgical face masks. It was an aerosol study that did spectroscopy, I can't spit the word out, but they did imaging of the particulate coming out of a person equipped with a surgical mask. Even if you're wearing a surgical mask 100% correctly, the study showed that the mask is only catching up to or less than 10% of the viral particulate that is being expelled from a person. And what I'm saying is combine that with the fact that children are already an exceptionally low risk group for this, and the other effects that this might potentially have psychologically. I have a autistic son who's in the school system here. He's in second grade with Mrs. Reed. And I can tell that he's struggling because he's not getting those external clues in terms of communication with his teacher and with the other staff in the room. So that worries me. I think that we should all try to be safe. I think that, things we were doing before, like don't send your kid to school sick, wash your hands, these are common sense things that people should do and should still be continuing to do. But I just want to basically come up and voice my opinion that I urge you all to maybe put a little less weight on case counts and really think logistically about, are people really getting sick? Because I think ultimately case counts aren't that important. This is an aerosolized respiratory virus that is going to go around. It's going to infect people, whether we like it or not. At this point, we're beyond the pandemic stage. This is going to be endemic. And just to wrap that up, I just want to say that knowing that, we cannot continue to live on like this forever. All I would like to see is for some return to normalcy. I'm glad the kids are in school. But if it's at the cost of our liberty, if it's at the cost of our psychological sanity in some cases with some of these kids, they might be special needs, what have you, I just don't think it's wise. And then in particular, in regards to the other gentleman's comments about PCR testing, just real quick, he's right. PCR testing has been shown to not be 100% accurate. Who's to say how many false positives or false negatives we had? What effect does that have on the total case counts in terms of positivity for COVID? We can't possibly know how many people have either had a false negative and gone out and maybe possibly spread the virus around, or how many people have had a false positive, and they don't actually have the virus. So what I'm saying is, without a reliable testing method, and considering that we're not testing against more than one thing, there's too many variables And I think we should err on the side of normalcy rather than err on the side of fear. And that's all I have to say.
What's your name?
My name's Alan Albritton. Thank you, guys. Thank you for your time.
Good evening. I have a pre-recorded message from Dr. Stevens, who wasn't able to be here tonight as she is on her, ending her quarantine. I'm gonna play this message.
Mr. Stevens, can I interrupt you just a second?
You may.
If you feel comfortable, you're far away distance, we have a lady that she's hard of hearing. If you want to take your mask down, you can.
Oh,
And
that's
that's
okay.
it.
It's a pre-recorded message, so
Oh, okay.
I'll put it right in the microphone. Thank you.
A mother and a wife second, an American third, and lastly, a physician. The views that I plan to express tonight are my personal opinions and not those of my employer or our local medical community. I plan to address two claims at the last school board meeting that I was unable to address at that time. Number one, science says that cloth masks on children reduce the transmission of COVID-19. Number two, hospitals are at capacity due to the COVID-19 pandemic. In medicine, the scientific gold standard is the randomized controlled trial. In such, a hypothesis is developed, participants are randomized either into the control or the test group, and outside factors that might affect the outcome are controlled for to isolate and answer the question at hand. A retrospective study looks back on medical outcomes and extrapolates from the data collected. In retrospective studies, you cannot randomize or control for outside factors, which is the greatest limitation to this type of study. With COVID masking data, you must ask yourself, are there other factors that could have resulted in a reduction in viral transmission in the last 12 months? I can think of several: workplace shutdowns, cancellation of large in-person events, lockdowns of travel, hand washing, improved ventilation, temperature checks, and social distancing, to name a few. In one large retrospective study in Georgia, the CDC looked at 90,000 students and faculty and found that while masking adults did seem to reduce transmission with faculty, along with improved ventilation, masking children did not reduce COVID-19 transmission. The CDC used this survey to convey that masking in school works, using a process known as file drawing, where desired data is highlighted and undesired data is minimized. Another more recent study in Bangladesh, which by scientific standards was lacking procedurally, found that cloth masks do not reduce the transmission, and surgical masks reduce transmission by only 11% in those over the age of 50. This study again has been used to convey that masks as a whole work to reduce transmission. Our local health officials have been careful to discuss our hospital situation by means of capacity and not bed availability. Our country has a severe nursing shortage. This has led to the need to divert patients to outside hospital facilities despite open beds. We should be asking, with nursing schools full, why are we unable to staff our nation's hospitals? Several factors play a role in this disturbing trend. Baby boomer nurses retiring, understaffing leading to a lack of support, poor pay, increasing workload, fatigue, and burnout. It's legitimate to ask how we should rectify this problem so that we're able to adequately care for patients when we have an influx, such as in a pandemic. I would argue that placing cloth masks on children during school hours and terminating nurses who are hesitant to receive a COVID-19 vaccine are two measures that will not solve the nursing crisis. In fact, the latter will undoubtedly worsen our already dire staffing situation. I have provided our local COVID numbers, both in kids and adults, in print form from both the CDC and the American Academy of Pediatrics. At our last meeting, it was struck.
Apologize. I'll also be taking time from two individuals in the crowd so that we can finish the video. Mr. David Woods and Lavera Woods.
That data would be shortly arriving to prove the Delta variant would result in much higher hospitalization and death rates in our child population. This claim has not been validated by the numbers provided. I will leave these numbers for you to review on your own. Let me give you a statistic that does hold true. 100% of people in this world will die. As a physician, this both pains me and gives me purpose. As a follower of Jesus, I know that while I will ultimately fail in my endeavors as a physician to prevent death, There is hope beyond this life. In John 5:24, Jesus says, "Truly, truly, I say to you, whoever hears my word and believes him who has sent me has eternal life. He does not come into judgment, but is passed from death to life." Jesus never promised that we would have a life free of suffering, but he did promise the hope for a better life following this one. I have noted a troubling trend in our Western world, a crippling fear of death. I do believe this fear has dictated our current health policy. We are so afraid of death that we are stripping ourselves of the joy of life. As an adult, I can manage my own discomfort with lack of liberty, but as a parent, I struggle with the fear that we're passing on to our children with our actions and our attitudes. The Bible says in 1 John 4:18, "There is no fear in love, but perfect love casts out fear. For fear has to do with punishment, and whoever fears has not been perfected in love." I worry our children are being taught fear in our schools. They're being punished by no fault of their own. They're being made to lose out on privileges, like recess, when they fail in their mask adherence. They're being told that they will die if they don't comply, or worse, they'll be responsible for the deaths of others. Our teachers and administrators may not explicitly say these words, but their actions speak louder than words. I've had children in my office with this virus terrified that they're dying, and when I relay a positive test result, there's no amount of counseling that convinces them otherwise. My daughter is 15. My husband and I have taught her how to think for herself, to look at the world with a clear head and to seek truth. We've taught her to question not only the world around her, but her teachers and even us as her parents. Scripture says, "I have no greater joy than to know that my child is walking in the truth." My daughter will respect authority while questioning their actions and words. I worry about young children who do not have the benefit of this upbringing. The stress and anxiety of our world today plagues our children. Depression and anxiety are rising dramatically in our most vulnerable population. Fear and isolation are the root cause. Remember that our children are not immune to our stressors. I understand that our school board is unlikely to change their position on masking. I've repeatedly been asked, "Why are you even doing this, Rachel?" I'm here today to teach my daughter yet another lesson. She is aware that I've received some discomfort from speaking publicly. 2 Timothy 1:7 says, "For God did not give us a spirit of timidity, but one of power, love, and self-discipline." I hope that my words and actions today teach her not to be timid in her beliefs. My job as her parent is to teach her that while there will always be hardships on this side of heaven, including death, disease, anger, hate, and disunity, there's always hope in eternity. Jesus said, "I am the way, the truth, and the life, and no one comes to the Father but through me." As a physician, my duty is to show love and compassion to those who come under my care. This includes the vaccinated and the unvaccinated, the abusers and the abused, the addicts and the apathetic, the poor and the rich. As an American, my duty is to honor the patriots who have sacrificed for my freedoms. As a mother, my duty is to train my child in truth and righteousness. And as a follower of Jesus, my duty is to live in the hope of his resurrection and to share that hope with others. The end of the book says, "He will wipe away every tear from their eyes, and death shall be no more. Neither shall there be mourning, nor crying, nor pain anymore, for the former things have passed away." As you enforce your current mask mandates, I ask that you promote an atmosphere of hope to our children. Show love and not punishment. Show mercy and not fear. Thank you again for your service to our community and our children.
Thank you all for listening and your patience. I do have this data that she has provided that she'd like me to leave with you, please. Thank you.
May I remove my mask for the... Hello, my name is William Sarton. I'm here representing myself. Mrs. Jan Poland will be yielding her time to me tonight, so that way I don't have to run through here really quick. This speech is prepared by me and me alone, and the opinions, while they may agree and disagree with some other people's, are representative of my own and do not affiliate in any way with mine or my wife's workplaces. USD 248 Board of Education members, you are elected to your positions to be a representation of the voters in your assigned districts, primarily the parents of children who attend USD 248. At the August 2021 meeting, we were told that our concerns would be taken by you under advisement. Many of us in this room and far more throughout the community feel that our concerns may have fallen on your deaf ear. I say ear in singular because you have an ear that is capable of hearing one side of an issue and acting on it quickly. But the voices from the other side are not heard, nor are they listened to. At the last meeting, we heard arguments on both sides of the face covering issue, solid arguments on both sides that are backed by science and research. As parents, we can all believe and agree that one child getting sick or dying of this virus is one too many, correct? I understand the seriousness of this virus. My wife and I both contracted it at the end of July, which resulted in delayed in-person start of school for our children, neither of whom ever developed symptoms despite being stuck for 3 weeks in the house with 2 sick parents. I have a close friend who is having to relearn to walk after surviving COVID-19. While I haven't lost anyone to the virus, I have friends who I consider closer to me than blood who have. My wife and I have both worked through the pandemic, her in healthcare even, knowing that she was potentially caring for patients that may have had the virus. I can't be sure of that because she is strict on the HIPAA rules. If my own mother was in the hospital and didn't want me to know about it, I wouldn't. We consider ourselves fortunate enough for avoiding it for as long as we did, and that it didn't affect us as much as it has others. We knew the risk and we accepted those risks, using appropriate safety measures as the situation deemed necessary. My former job as a chemical applicator required me to be well involved with the use of personal protection equipment. Some of the chemicals I handled on a daily basis would kill me or critically injure if it handled incorrectly. I wouldn't be speaking to you tonight if it wasn't for the use of safety equipment and precautionary measures. 22 out of the 30 schools that we compete against in close contact athletics have no mask requirements, with a couple more offering exemptions. We allow our athletes to be in close proximity to other players, including players from other schools that your rules would deem to be dangerous, without personal protection equipment. Athletes have a respiratory rate of 100 liters per minute compared to 12 liters per minute at rest, source of the National Institute of Health. If the school board, under the direction of the medical community, truly cared for the safety of our students, then athletics would have been modified or canceled altogether. Is it because the prestige and notoriety that athletics can bring to a school outweighs the risk that those events would impose to the players or fans? Both by your own definition. I'm here to call out the school board and the administration of USD 248 on their hypocrisy to their own rules on the requirements of face coverings. What is the priority of the school? Is it education or is it sports? How is it that our athletes are at a safe enough risk level to continue to play as normal? Fans on both sides, both in the student and community, still scream their Trojan pride at the top of their lungs from the stands as if there is no danger. But our students, sitting quietly at their desk, a respiratory rate 1/8 that of an athlete at play, have to operate as if they are in a BSL level 4 biohazard environment. If you truly believed in your firm stance on our children's safety, I would expect you to immediately cancel all athletics and post a public apology to the parents and community for the unnecessary risk that it created to our students and community. I will not hold my breath on that. I'm actually not looking to cancel athletics, but rather to get an answer for how one thing is safe, but one thing isn't. How is it that some school groups are shown repeatedly in photos on the school's own social media accounts unmasked in close proximity, yet other groups are denied the opportunity to meet? How is it that even today a special speaker is brought in to speak and they had their pictures taken side by side with many of the faculty in the school, all of whom were unmasked? How is it that you are frequently seen throughout the community not wearing the same protection that you require of students? And how is it that students in the elementary school can get in trouble for high fives on the campus, but if you high five another teammate after scoring a touchdown, it's okay? It must be rules for thee, but not for me. You all have a great start for the career in Congress, but you won't get my vote. I had great memories growing up in this school. My children, unfortunately, will have their memories marred by the skid mark that this illness has left on the world. This is a picture my son drew last year of how he sees himself now. The mask is now a part of his identity. Our faces are what make us unique and as individuals, but even now that is at risk. Finally, I want to remind you that the school board is an elected position, and the parents that elected you to your position have the power to remove you from that position. You were elected to represent us, but when was the last time any of you talked to a parent outside of your close circle? We have remained quiet for far too long, but not anymore. Your lack of competent leadership have caused us to rise up. We are awake now and will remain so, holding you accountable to your elected duties. or until such a time as we can replace you with somebody who will. Somebody with the strength to listen to their constituents, even when it opposes a louder minority. We're not demanding that masks be removed from the school, but rather that changes be made that make sense, but also allow for us parents to have a say in the health and safety of our children. Remember, these are our children, not yours. Parental consent should be considered in all future policies regarding this, including any safety measures, testing, and if it comes to it, the shot. Thank you very much.
Good evening. My name is Amanda Lehman, and I am a Girard alumni, lifelong Girard resident, a mother of 2 former Girard students, nurse, and a taxpayer. As a Christian parent, I cling to Deuteronomy 6:4-7, which says, "You shall love the Lord your God with all your heart, with all your soul, with all your strength. These words which I command you today shall be in your heart. You shall teach them diligently to your children. Talk of them when you sit in your house, when you walk by the way, when you lie down, when you rise up." This is where I get my cues for parenting. It is my job as a parent to teach my children morality and education, and it is my job to care for them both physically and emotionally. It is the mission statement of the school to provide an excellent education and safe environment for my children. Let's look at these areas. Since the last board meeting, COVID restrictions at Girard schools have gotten stricter despite there being 0 pediatric COVID deaths in Kansas and only 36 pediatric hospitalizations in the entire state. And the politics have disrupted education. In the days prior to removing my children, they offered me multiple instances of teachers being removed from the room in the middle of class time to discuss COVID protocols, to implement new protocols within that classroom, to reprimand teachers for violations on protocols, and on one occasion it was implied that a child in the room was to blame for a school outbreak of a highly transmissible virus that they did not have. My children were made aware of emails that were circulating between health officers, administrators, and teachers. This is extremely unprofessional. I would like to contrast this response to COVID that is hindering education with other safety issues. If we want to invest time, money, and discipline in the safety issue, I would suggest one of the following. At last month's meeting, I gave statistics on over 4,000 children who visited the hospital each month earlier this spring for suicidal thoughts and attempts. Many children are not dying from COVID, but many children are dying from hopelessness and isolation. The next issue is internet safety. The first time I became aware of this issue was when my children were in 3rd grade and handed an iPad to use unsupervised. Although few restrictions have been put in place over the years, I can assure you that as of the day my children were pulled from school, students were still able to watch movies on iPads during class, text with each other on school-issued devices, and speak with people outside the school building on the same devices. I have been told it's a regular occurrence for cell phones recording video to be taken inside the locker room when girls are undressing and posted to social media. These are not isolated incidents, and this is not observing safety. In the United States, according to Child Advocacy Center, 1 in 5 youth ages 10 to 17 receive sexual solicitation online. Why is this issue so looked at and not that issue? I'm doing my best as a parent, to parent my children according to what Scripture is prescribed, and I understand that I have the choice not to accept the decisions you have made. This month, I've exercised my choice by removing my children and their funding from this district because of the decisions being made. I ask you again this month, please consider the values of the parents in your district and the taxpayers who vote in this city. Thank you for your time.
My name is Naima Harley, and my 7-year-old is a former student of Girard schools. We had to pull her out because of the mask mandate. She has a medical condition that does not allow her to wear it. There were no exemptions given. There were no accommodations given for a very serious medical condition. Today I wish to speak to 2 groups. First, the Board of Education, and second, to the concerned parents of USD 248 students. To the board, these COVID-related problems are doing more harm to our children than good. First, the mask policy. You heard last month at the meeting the statistics, the emotional pleas of parents, and the concerns of members of the medical community. These conversations have fallen on deaf ears. As a parent of a special needs child whose medical condition is negatively affected by mask wearing, my concerns have been disregarded, and I have been told that she needs to, and I quote, and apologize for one word in this quote, just wear the damn mask. While these exact words have not been uttered by this board, the policy you've enforced say just that. I ask, would you tell the blind student to just read the darn assignment? Would you tell the student with the broken leg, just walk up the darn stairs? Would you tell the child with the peanut allergy, just eat the dang sandwich? All of these questions would and should be met with an emphatic no. Why then are you not allowing for accommodations for students whose mental and physical health is negatively impacted by mask wearing? As the parent of a special needs child, it feels very discriminatory. Secondly, the announcement today that Girard will look at implementing a test to play, test to stay is appalling, to say the least. It treads on parental rights to make medical decisions regarding our minor children. A hospital cannot perform surgery on my child without my consent. A medical clinic cannot draw blood or give a vaccination without my consent. The school itself cannot give medication without my consent, and in many times without a doctor's note, especially in the case of my daughter who is taking neurological medications. Why in the world would you have any right to perform this medical test without my consent? This doesn't even touch on the mental and physical consequences of these tests on children. My daughter has had to undergo a COVID swab twice as a requirement for surgery. She has extreme anxiety for all things medical. Administration of the test results in screaming, shaking, fear, physical pain, and nosebleeds. You are implementing a policy that is, especially without parents' consent and presence, overreach at best and abusive at worst. Thank you.
Beginning at 7, we were set up to go into our budget hearing, so the USD 248 Board of Education will now convene for the purpose of the hearing and answering objections relating to the revenue neutral rates and proposed tax rates as published in the Morning Sun on August 28th. There are copies in the room, I believe, around if anyone wants to take a look at them, but are there any questions or objections in regards to the revenue neutral tax rates as published?
Can I ask a question? Will there be prolonged public statements at the end of this? With that?
Yes.
Okay. Right after this?
Yes. When we publish this at 7 o'clock, we have one hearing. At 7:05, we have another.
Okay.
And we do that all the time. We dead stop right what we're doing, and we do that, and we come back.
Okay, thank you.
If there are no comments, we will close the 2021-2022 USD 248 hearing for the revenue neutral tax rate. I would entertain a motion to adopt the resolution to exceed the revenue neutral tax rates as determined by the county clerk.
So moved.
Moved by Peggy, second by Kelly. I have an approved motion to adopt the resolution for USD 248 to exceed the revenue neutral tax rate. Everyone in favor say aye. Opposed, same sign. Resolution passes. We are moving into our second hearing. The USD 248 Board of Education will now convene for the purpose of hearing and answering objections relating to the 2021-2022 budget and proposed taxes to be levied as published in the Morning Sun on August 28th. And again, there are copies in the room if anyone wants to take a look. Open for comments. Are there any comments or objections? Hearing none, we will close the 2021-2022 USD 248 budget hearing.
I want to, we're not going to ask to approve the budget tonight. There was a Recreation Commission levies a 1 mil through our district, and they had some issues getting publishing on time. They did get it published Friday. We thank Mr. Stevens for that, but the earliest they can have their hearing and their meeting is Monday on the 20th. So we would wait till they are finished with their business, and then I would ask that maybe we entertain a motion to have a special board meeting on Monday, September 20th at 12 p.m. and that will be following their meeting in the morning to approve the budget officially.
So I entertain a motion to move that meeting to Monday, September 20th at noon.
So moved.
Moved by Dave,
Second.
second by Peggy. All in favor, say aye.
Aye.
Opposed, same sign. Motion carried. And that will close our budget hearings.
And you go back to patrons' comments.
Yes.
Oh, I'm sorry.
RJ Jubber, and I will be taking the time of Grace Jubber and Sarah Poteet as well. First of all, thank you for hearing us today. Sounds like there's a lot of very well-educated folks in the community. Sounds to me like we have a community who really cares about this issue as far as it goes with the masks. And we also have a community that has educated itself so much that they are really clearly listening to the science associated with this issue. So, before I get started, I would like to make a statement. Any retaliation, phone calls to employers, or intimidation to those who have spoken out against the mask issue is shameful, disgraceful, and wholly un-American. So those watching online or those who may be here, I say that would engage in those tactics, I say shame on you. Our country was founded on the idea that we are a free society, open to debate ideas publicly without fear of losing our jobs or being intimidated into silence. I know that there are plenty more people that would be willing to speak here tonight. However, after speaking up last month, they felt that there are folks in the community that would put pressure on their employers due to a difference of opinion about this subject. So, to those who would take that tactic tonight, if you have issue with anything I say and would possibly feel the need to contact my employer, I say call me first. Talk to me face to face, reveal who you are, and I'll give you my boss's number directly. And you can call them after you've talked to me specifically. My number is 249-0919. Thank you. So, before I get started into my opinions, I would like to just recite some facts. The U.S. case fatality rate is 1.61%. So that is a 98.39% survival rate since the beginning of this pandemic. More locally, total cases in our county as of the beginning of this pandemic, 6,455. I took these a couple days ago, so there might be some discrepancies in today's cases. We're a county of 38,818 as of 2019 census, so that is only a 16% infection rate in this county. The total deaths so far are only 100. Again, that is a 98.5% survival rate. And nationwide, only 6% of those total deaths were caused by COVID only. The average comorbidity rate associated with death and COVID is around 3 to 4, depending on what study you look at. So, follow the science, please. The scientific method can be defined as a method of procedure that has characterized natural science since the 17th century, consisting of systematic observation, measurement, and experiment, and the formation of testing and modification of hypotheses. It is not following directives of a medical community. That is not science. The science says, follow the studies. Look at the studies, look at the facts. Be led by science, please. I would ask you a couple questions. How many places in Crawford County are mandated masks? How many businesses in Crawford County has the health department mandated masks. I checked. Schools are the only ones. Why? Please ask yourself, why are schools?
Because they
the
have
only-
a great amount of students within a small space, relatively, because I struggle with that.
Yep. So that brings me to mask effectiveness. Do masks work? Are masks effective? Yes, if used properly, in the right context, and the right quality. I would point you to 2 studies. If I can pull them up here. One is called The Effectiveness of Adding a Mask Recommendation to Other Public Health Measures to Prevent SARS-CoV-2 Infection in Danish Mask Wearers. The second one is SARS-CoV-2 Transmission Among Marine Recruits During Quarantine. Those 2 studies showed that yes, masks worked. Unfortunately, not for prolonged periods of exposure, only using N95 masks, and only inside in close proximity with low ventilation. I don't see any N95 masks in the room. In fact, I see improper use of masks all over the room. If we're gonna follow the mask studies as a guidance from our health community, let's follow the scientific protocols that were in place when the study said masks work. If not, we are just going through an exercise of futility. That's all we're doing. It's an exercise in futility, and we're enacting psychological issues on our young children due to the covered nature of our faces. So I've got one more round, correct? Okay. I would also say correlation is not causation, folks. Our health department said last year we didn't have to shut down schools because we used masks. Again, as the doctor said earlier in her statement, what other scenarios were leading to us staying healthy as a school community? Just because there's a correlation between masks and health of students doesn't mean that the masks were causing our students to be healthy. Follow the science. Correlation does not equal causation. The third thing I would ask is face covering consistency. If we are going to require our students to wear masks, I would challenge the faculty, the administration, and the staff. Are you 100% of the time adhering to mask policy that you implement on our children, that you give detentions for to our children? Because I have witnessed administration, staff, and faculty not adhering to the mask policy that they have mandated on my children, that you guys have mandated on my children. That is wholly unfair, unethical. So, in conclusion, like I said earlier, please be led by science. Use logic in policy applications. There is so much information available to us these days as it comes to COVID. It's effective treatments, it's effective preventative measures. Masks, especially cloth and paper masks, are not effective treatments. Student discipline until administration, staff, faculty are adhering to 100% is absolutely wrong. And let's move past the misguided and clearly unscientific, although well-intentioned mask policy, and let our kids get back to learning unmasked, please. Thank you for your time.
Does anybody have any patron comment on this issue we've been talking about here? Mr. Murphy has a student issue, and it's going to require to go into executive session to protect the privacy rights of students. But before we do that, if somebody else had some comments, we might let them jump in before we do that.
Good evening, school board. Am I allowed to take off my mask? Well, hi again. My name is Corey Humble. I'm a senior here at Girard High School. I'm the senior class president, and I'd just like to state that in no means is what I'm about to say word for word exactly what every single student in the student body here at Girard High School would endorse. But it's an opinion that I believe I share with some of my fellow peers. Personally, I believe that the use of masks within inside of schools is correct. That's not the most popular opinion here tonight, and I understand that. But the reason I feel this way is I do believe that it does slow the spread. Personally, I am a 17-year-old who has mildly severe asthma, who contracted COVID last Thanksgiving. I woke up every morning with shakes, unable to breathe. One morning I woke up and I couldn't see. Sure, I could still taste and smell things. That was pretty great because it was Thanksgiving, of course, but everything else in my body really did make me feel like I was dying. And I know that not everybody had the same experience. Like I said, I have mild to severe asthma and I've had previous health complications. But I also believe that I didn't receive COVID for an extended period of time there if it hadn't been for the mask. I went to the state fair this past weekend and I wore a mask the entire time. I walked around Yellowstone National Park with a mask on, outside. And this is because I was in close proximity with people, and it's because through the beliefs of different studies and understandings that masks were effective against the COVID-19 virus. And those certain studies have come out that say that aerosol sprays have been shown, that certain things have been shown. I will say that in a class of however many people in my physics class, I was the only one to catch the COVID-19 variant from somebody. And we were all wearing masks, and I might have been inappropriately wearing one because I have a tendency to wear my mask like this. It's because my glasses keep it in place, I bent the rules, and after receiving COVID, I felt as if I cheated the system in a way that negatively affected me. I believe that if I had been properly wearing one, I wouldn't have had it. So my mom can get mad at me later for not wearing my mask right. But it's my belief that they do help. It's also my belief that by letting the spread of a virus throughout our school just act like normal, like with the flu, it will harm our students. Currently, as a policy, I would have to take all of my end of semester finals if it wasn't for the fact that last year you guys exempt that because of COVID. Continuing through this, if we just go back to a state of normalcy as if we act like nothing happens, I would have missed 2 weeks, because I honestly felt sick for 2 weeks of school, being forced to take all my finals and losing tons of schoolwork in the process. It's my belief that students here should remain familiar with the ideas of wearing a mask. They should remain educated on the ideas of wearing a mask, and they should remain educated on following health and safety. And not to use a slippery slope argument, but if we let up on the mask, who's to say we're not going to let up on hand sanitizing? Because I know for sure I have. I notice every single day in class, not a lot of people hand sanitize like we used to at the beginning of last year's school year. Who's to say that we're going to continue to socially distance? Who's to say that we're not going to we're going to stop taking those preemptive measures that might have mixed this study data? That's my time. Thank you.
My name is Sherilyn O'Plotnick, and I spoke last month, and I feel like nobody listened. My child had COVID on February 14th. Since that time, he has had multiple health problems. In March, we started him with massive headaches. We've had 3 ER visits, 2 hospitalizations, 7 IVs, 4 blood work, CT, MRI, sedated for 18 hours at Children's Mercy to try to stop the pain. Now we have routine visits with the neurologist, rheumatologist, pain management, and hematology. My point is, even after all of the things that child has been through, he begs not to wear a mask on a daily basis. Now we are fighting croup because of the mask, because he is tired of wearing it every day, and because it's causing him to have his larynx swelling up. During that time, he had 2 negative COVID tests. 2 of the PCR tests tested negative. It wasn't until mid-March that we actually got a positive test, and that was from the antibody test. So my point is, if this board is considering moving to the test to stay, that test is not very reliable. I went and did some studying on it, and those tests are only 80%, and that's in one of the good studies. 17% of people will get a false positive. 6% will get a false negative. So are you prepared to send children home whenever they don't actually have COVID, but the test says they do? I don't think anybody wants to see a child go home whenever they're not even positive for it. The other thing with those tests is most of the time, they will not test until day 5. You will not get an actual reliable test out of those tests. So I don't like the mask idea, but I definitely don't like the testing. And I don't think that it should happen in our schools. If it happens, our children will most likely be pulled from the school and go to St. Paul. Thank you.
Am I allowed to make some patron comments? I want to just do a little bit of follow-up. First of all, I do very much appreciate, put the timer on. Appreciate the comments. I want to say this too, most of these people, I've seen many of you as former students. I've been with your kids, coached your kids, and I think very highly of you, I do. And I'm very impressed with some of the information. It makes you, kind of scratch your head sometimes. But also, though, I think we have a communication issue, and that's not on me. But I do, as I hear some comments, I do want to do a little bit of follow-up. First of all, on this testing deal, I have had a plethora of calls about testing. We have not had a discussion with this board about testing. What I did do is I asked if it, I indicated, I think, to Dr. Stebbins and Terry that we were looking into that. There's some grant money available, quite a bit of grant money. If somebody wants to give us some money to hire an additional nurse, and they want to do, if we want to look into it, but I haven't even presented anything to the board. That's just in the inquiry stage. The other thing is, if we ever did any type of testing, and I don't know if it's how effective it is or not, that's just an inquiry, we would never, ever test a kid without parental support. And that's what most of the comments came from today is, I can't believe they just start testing kids. We're not gonna hold kids down and start plucking them with a needle. I don't know where that came from. So I need to clear that up. Another thing is, we talked to one of the ladies mentioned about a medical condition. We do have in our policy, if there's a doctor's note or doctor's verification on a medical condition, there are other options to a mask. That's always been in place. I was a little bit perplexed to hear that. And then some of the comments I hear, we hear this or we hear that. It's the first time I've heard them too. And for some of you that do know me, I have a very open door policy, and I hope that you would come and visit with me about some of those things, because I need to know. I don't know what is factual. I believe it's factual to you. I think you've heard that, but sometimes what we hear and what actually is can vary a little bit, but I'd sure like to delve into some of those issues as well. The other thing is, for me personally, and I hear this a lot, nobody's listening, and I'm not talking for the board, I'm talking as a patron. I listen. I listen to a lot of people, and I listen to a lot of people on both sides of the fences. I don't like these masks. I don't like them at all. I don't know what guidance to give. I'm not a medical person, and we're gonna get a little bit more into that in a little bit, but it's not a case of nobody listening, and I wanna say too, and you know, William, you made a comment and spoke very eloquently. You know, we talk about listening to constituents, and I'm just telling you personally, for me, I hear just as many from the other side, but they're in a situation where wearing masks, so they're okay with that. It's a tough deal, but I don't want to see it tear this community apart and tear these people apart. I see it in my own family. It's a tough deal, but I'm going to tell you, we are listening. I'm listening. I'm just a patron commenting. But on some of these things that come up that I hear, I'm shocked to hear them. And if those are the case, I hope that you'd come and share them with me. I have an open door policy, and we will visit. And I promise you, I tell people all the time, I'll get to the bottom of it. That's all I have. Anybody else? Or?
I'll get it.
Well, what's your comment concern?
My comment concern is about a disciplinary referral. My son got a detention because of a mask not wearing a mask properly.
Yeah, that does need, that's executive session. So
Is that?
Rights of students.
Okay.
Yeah.
I have a motion to make, how long do we need?
Start with that.
How long do we need?
Yeah.
5 minutes?
I would need that over.
Okay. I have a motion to move into executive session for 5 minutes to address student disciplinary.
So moved.
Moved by Dave, second by Brian. All in favor, say aye.
If they want to leave, they can leave. If they want to stay here, they can go out to the.
I had that same part.
I don't have that.
It would look good on you.
Item number 8, approval of donations. Let's hold on.
I recommend we accept a donation from Freeman Orthopedic Surgical Center. It's $5,000 for the turf project. That's their year 4 commitment. Melissa Smith Chiropractic, $500 donation, Girard High School FFA. And the Fallen Trojan alumni donated $6,500 for Girard High School baseball softball program. I recommend we approve those.
So moved.
Moved by Dave, second by Peggy. All in favor? Aye. Pose same sign. Motion carried. Moving to item 13, 2021-22, return to school and COVID updates.
We're going to give just an update here a little bit, or you can look at them on our website on our incident and COVID rates right now. But I do want to introduce Dr. Tim Stebbins. He's our Crawford County Health Officer. We've been working with us for over a year now, and he's going to give you information and answer some questions you may have. And then also Teddy Bankim, I'm sorry, but you were here last time, so they knew who you were. So.
All right, good evening. Again, I'm Dr. Tim Stebbins. This is Teddy Van Kam, co-health officers for Crawford County. I'm also the medical director, essentially the Acoustic Emergency Department here in Fort Scott. We appreciate the opportunity to come before you today and talk to you about what we know with respect to COVID, update you on the current stats, and also take a moment to discuss the new benchmark recommendations for moving to the mask optional state. We'd also entertain questions from the board as you would like. We're here for you to support you and be with you through this process as we navigate this difficult time with COVID.
We'll start off with last week. We ended the week with 115 new cases. That equates to 294 per 100,000 on the case rate. That's down from the week before of 158 cases. This involved all age groups. The 0 to 17-year-old age group was 27% of those cases, with the number of 31. Incident rate has decreased, which we see as a good sign. As we began our spike in late June, early July, as we encountered the Delta variant, we saw a rather rapid increase in our case numbers. And that was largely attributed to the greater transmissibility of the Delta variant. That obviously was the challenge as we came back to school, which we'll discuss more in a minute. Last week we ended our isolation with 132 cases in isolation. That's active sick persons in the community, and 396 in quarantine. Our hospital capacity, according to our gating criteria and discussion with the hospital staff at both Girard Medical Center and Ascension Via Christi, was at approximately 15%, and that included 15% ICU capacity. We are still having some challenges with local referral patterns, with movement of patients from our facilities here in this county to other regions. And those are for things like neurosurgical care, dialysis, advanced trauma, advanced orthopedic, and pediatric care. We are using a service called Mission Control, which is being utilized all over the state of Kansas to help us find beds. Last week, we had several cases where we had tried for hours and even days to transfer patients. And they will make calls. I worked an overnight shift last week. We had all of the tertiary centers in Kansas, and then expanded to Missouri, Iowa, and Nebraska, without finding a critical care bed. So, but I will tell you that's getting better, so that's a good sign. So our capacity has improved some. There's a question about capacity, and I want to clear that up. When we talk about beds or capacity, it doesn't matter. If you don't have a nurse to care for the patient, it doesn't matter how many beds you have in the hospital. We can put 120 beds at Via Christi. We can double the beds at Girard. But if you don't have the staff to care for it, it's an empty hallway. It doesn't matter. And so we have to ask that hard question to the hospital: what can you care for? Now, largely recently, they have had the staff, and it's been actually a bed number issue. That's not every day, because nurses suffer from COVID and other illnesses as well. And so there are some days that they just, quite frankly, don't have enough. And it's not as easy as just hiring a nurse. Warranting a nurse can take 12 weeks. Class ended in May, right? So there's no graduate nurses available right now. The Wichita systems hired 160 new graduates, right? And they still have 30% higher needs. And so there's more spots than we have nurses that are coming out of the graduate training programs. So we're trying. I will tell you with 100% certainty, each one of those systems are trying to get as many nurses as they can to manage this as we go forward. And but again, it doesn't matter. If they have the capacity, if it's a bed issue or a nurse issue, it doesn't matter. It's what they can take care of. And that's the question we ask. Today, we had, at Via Christi, we had 2 ICU beds, 2 step-down beds, and 2 med-surg beds available. That's out of 12 ICU beds, 6 step-down beds, and 33 med-surg beds. So that capacity is still right at 15%. Now, again, it's getting better. It is getting better, and I do see light at the end of this tunnel. Deaths, as of the end of last week, were 104. We're up to 107 as today, as we lost another person last night. Long-term care facilities, thankfully, are doing quite well. We've finally moved COVID out of those facilities, and they are working very closely with us. We talk with them also each Friday on our health call, and we work closely together to help manage what's going on locally, and they're doing a great job with their policies in taking care of their residents to keep them safe. They are also suffering from a staffing issue, right? Which creates some bed space issues there, which causes a forward flow issue as we bring patients into the hospital, and sometimes they need the skilled nursing after the hospitalization. And they end up in the hospital for quite a while as we try to find a space. But we don't have COVID in the facilities, which is nice. We've got adequate testing currently in our region through the health department, almost all the major pharmacies, CHC, and Southeast Kansas Urgent Care, as well as the hospital systems. I'll briefly touch on PCR versus antigen testing, because there was some information that was given to you that is inaccurate. PCR testing is 99% sensitive for COVID-19. Antigen testing is approximately 80%. There is no 100% human, and if anybody tells you that there is, they're lying. There is no 100%, right? We can't achieve that. There is only one perfect person, and we're not it, right? And so, but it is very effective in finding, the PCR test, very effective in finding the disease. COVID actually infects multiple areas of the body though. So starting out in the upper respiratory, moves to the lower respiratory, and can even move into the GI tract. And so it is possible that we don't find it on the first one because it's not where it's at the time. Yes, ma'am.
What's the PCR test?
So it is a molecular-based study.
How do they do that?
It's the same nasal swab. So there are different versions. There's the nasal swab, anterior, deep, we use the deep. And then there's also saliva tests that can also utilize the PCR technology. And there is a dozen at least different testing technologies available just in the PCR molecular realm. And so any one study to suggest about all of those wouldn't be accurate. You need to look at each one of those specifically to determine the sensitivity and specificity, both the PCR and antigen. So contact tracing, we continue to do 100% of our contact tracing within the county. That's to the benefit of us, right? KDHE has no idea who you are. They have no idea what your needs are. They have no idea how to approach the public on this. And they're using a rote script to talk with the persons, and we're not, right? A lot of these people we know. A lot of there are friends or people we care for, certainly in our communities. And so it is to our advantage that we do all of the contact tracing, because also it allows us the leeway for understanding for specific situations. Like the child in need earlier, we worked very closely with the interlocal for all of the districts and talked to them frequently about how to manage kids in need so that they can get the specialized care that they need to grow and be healthy, right? And so as Mr. Bauer indicated earlier, we'll work with that. We'll work with them, and we work with the districts as well. And so I need that known because it's important. We're not here to harm kids. We're here to help the school stay in class with our recommendations, right? And so, and we'll continue to do that. Vaccination, We have vaccination listed on our gate criteria that comes out each week on Tuesday. It shows the total number of vaccines given by the entities within the county. It is a little different than the KDHE data. KDHE pulls from WebIZ. WebIZ has your address. It knows where you live. Community health centers, the pharmacies, the hospitals, the health department, if somebody presents and we're giving vaccines, it doesn't matter if they're from Missouri, Bourbon County, Cherokee County, Johnson County. If they need the vaccine, we'll give them the vaccine. So our numbers are higher than our county numbers. And we have plenty of vaccine, right? And it's important that we get it out to anybody who wants it. We have about a 55% first dose, age 12 and up for the county population, and 50% total vaccination given for the county population. So of the 39,000, take away about 7,000 for those that aren't eligible, then that leaves the population that's eligible, and about 50% of that population has now received total doses of the vaccine, so that's good. Kids last week, we had 13 new cases in the 0 to 9 and 18 in the 10 to 17. This week so far, we've had an additional 4 in the 0 to 9 and 5 in the 10 to 17. Currently in our schools, that may actually be updated because I didn't pull it from this afternoon. 37 in isolation, total K through 12, and 98 in quarantine. And again, quarantine is high-risk exposures that we couldn't find another way around. So the impact is still kind of in that moderate range with those numbers, but declining, and that's also great news, right? As we looked at this and developed our initial, and I want to also clear up one more thing, we didn't establish a mandate. We've not mandated anything. We've made recommendations to all the school boards with the information that we have, so that you can make the decision, the best decision for your schools. And that comes from a lot of places, and that's all discussed in the initial mitigation recommendation letter. But essentially all of our all of our pediatricians, Kansas Hospital Association, and by and large, nearly the entire medical staff in your community, right, in our community, all agree with that recommendation. And so it is a recommendation. When we put that out, we recommended that we go into the universal masking in schools through October 1st, starting as we started school, right? In an effort to minimize the disruption in school, because the most important thing that we see is keeping our kids in school, right? We know that there is harm when they're not. Through isolation, some kids don't get fed. The learning environment is not, we're not teachers, right? The teachers are teachers, and they do a good job of teaching our kids. We're not, as parents. And so there's a lot of advantages of keeping kids in school, and so that's what that was geared towards. But we wanted to state right then that we were going to look at this masking recommendation every 2 weeks, and we have. And it's based on the benchmark criteria. So we have before you now our benchmark document that I will go over. Is there any questions so far before we get too far removed? So we put out the benchmark data recommendations for the mask optional state. And this is an effort to help you make the decision for when it's safer for your kids to be in a mask optional state and when it might be important to move back to universal masking if needed. We set October 1st as the time that we were gonna hard look at that. And the reason why is as we look historically at the data for our spikes in the community, we have seen that there are 6 to 12 week spikes. 6 weeks for isolated events, 12 weeks when you have multiple inputs. And multiple inputs like Thanksgiving and Christmas, 12-week spike, right? We had multiple inputs on this one, and so we utilized closer to the 12-week as a guideline for when we would relook at that. The multiple inputs, one, Delta variant, highly transmissible. And just so you know, since July 4th, 333 0 to 17-year-old kids have been infected with COVID, right? It took 29 weeks before that, 29-week period to equal that same number of kids, right? So 3 times faster we achieved the same number. But that's what we're saying with the Delta variant. It's that much more transmissible, and certainly more transmissible in kids. And also, it's the unprotected population. So anyway, we expect that this is going to go down. Our numbers will go down in that spike period, and that's the trend that we're seeing. The second input, July 4th, obviously, and then we also had another input with the return of kids to school and the return of kids to college, right? And then we added on just a little layer recently with the holiday, the Labor Day holiday. Any party holiday has a tendency to cause a little bit of a spike. We still see our decline, our trend heading down towards where October 1st, we feel we're going to be very close to meeting the benchmark criteria that we're recommending that you use. So there's 4 categories in that benchmark criteria. The first category is the 2-week cumulative rate. This all comes from the Navigating Change document for the gating criteria. That's from the Kansas Department of Education, right? And so we pulled their stats to help guide us, as well as KDHE and CDC recommendations, and put that into this document. So as we looked at categories, obviously being all green or being 0 level for everything is really not an appropriate expectation for COVID-19, in our opinion, and probably your opinion either. I don't think it would be appropriate for us to strive for 0 before we come out of mask, right? So we use the yellow category. So the first category is the 2-week cumulative county incident rate. That's the number of new cases per 100,000. We have approximately 40,000, our population in Crawford County is approximately 40,000. So that would equate to 40 new cases weekly over a 2-week trend. And that's on the chart on the second page. The second category is trend and incidence rate. Obviously, we would want that stable or declining. We've always stated that 1 week's of data is just 1 week's of data. 2 weeks of data are a trend, and so we need to see the trend, right? And so we just want to make sure it's setting, and so 2 weeks will give us that. The third one is the local referring hospital capacity, because it doesn't matter, irregardless of bed or staffing, if we can't take care of the patients, all patients, not just COVID patients, that's not what this is about. This is all patients. This is heart attack patients, car wrecks, dialysis patients, neurosurgical patients, pediatric patients, all patients. If we can't care for them locally, that's a problem, because people are being harmed, and we've seen a couple of casualties of COVID related to that already within the last several weeks. And that's difficult. That's hard for patients that would otherwise be able to be cared for in another system. We just can't get them there. And trying as far as South Dakota, Colorado, right? And so we need to make sure that we can do that. Now again, that is an improving category, which is good. That's good for our community, that we're able to care for more locally. We still have the problem in the referring hospital capacity. And they don't just serve us. That's what I need everybody to understand, right? The wave moved through us for COVID, for the Delta variant. We were the problem for the referring hospital capacity for a while because we sent so many, because we had so many sick. They're full. They're also encountering the wave. But now it's moved through us, so it looks better here. But the problem is, they serve a radius. KU serves a radius of a couple hundred miles, all around, right? And so as the wave moves, it's still in their sectors. It's still causing challenges within their systems. And that's all the Kansas City systems. Now we're doing a little better on the Joplin side as the wave moved through. Still jammed up pretty bad in the Springfield side in Oklahoma. But we're doing a little better in Joplin, which is nice. But understand that those referring hospitals, those tertiary care centers, the big centers, they take people from all over the place, not just us. And so it can still be a problem even if we're in a better state. Again though, I think that's a category that's improving. The fourth category comes into play when we move into a mask optional state, and that's the absenteeism, and that's to protect your system. So, new Kansas statute regarding kids in school, they have to be in person. If they're out of school for more than 40 hours, and please jump in if I'm expressing this wrong. If they're out of school for more than 40 hours, you have to give that data to the state to get approval for them to be out of that, or you lose funding.
There's two steps, and we're gonna do that tonight. It has to be approved as an exemption by the local board, and it has to be approved by the state board.
Or you lose your funding for each one of those kids. And that can be very costly for your system. And so, two things with this category. One, we want to help the schools in that respect, but two, it's a great look into the system by building. So for Girard, it'd be the elementary school, or kindergarten through 5th, and then the middle school, because they're in the same building, you have crossover teachers and even some students. So the 6th through 12th. If we see the absenteeism rate exceed 3% based on the number of students and staff in the building with respect to COVID, right, then we would recommend that you go back to the universal masking to prevent further spread in your school systems, right? And again, that helps decrease absenteeism. It helps decrease the concerns for funding and decreases a lot of work for the schools, school boards, and the Department of Education. And so we'll monitor that. We essentially monitor that every day. Well, Monday through Friday, and some Saturdays, and maybe even some Sundays. That's all discussed in the document by each. Again, this comes from the Navigating Change Gating Criteria document. Things that can help. One, obviously vaccination, right? Vaccination will prevent quarantine and sickness, right? And so it will prevent absenteeism. Another that actually was brought up to me today that we should have expressed more in the document is, well, and it's expressed in another document, our quarantine, isolation quarantine guidelines. If a person has previous documented infection, meaning they've been positive and we have a positive test, we don't quarantine that student. We don't quarantine if you have previous documented illness, right? Antibodies unfortunately don't work. It's not approved by the state, and that's above me, right? But previous documented infection, if we know that you're positive, because you've had a positive test, we won't quarantine you. And we have a little leeway here, and we've taken it, irregardless of when you had the infection. So if you had the infection April of 2020, we're counting you immune, right? Versus the 6 months. So we're trying to do everything we can to prevent impact on the kids and taking as much leeway as we can safely, right? And so the other thing that you can consider, and I would encourage you to consider, that was brought up earlier, and I apologize, I'm gonna apologize to all of you. I think I was the one that set in motion the misunderstanding about the test to stay, test to play. Because the commissioners asked today about that, and I mentioned that Colgan is looking, or getting ready to put that in place. Cherokee has it in place, and Girard was considering it. Just because of a discussion that we had, right? Because test to stay, test to play, if the parents opt in and the kids allow for it, prevents quarantine. So it prevents absenteeism. So it keeps us in the mask optional state, right? It decreases that number, it keeps us below that threshold. And so that's an effective strategy to consider. And there's a lot of funding available that can help you with that, so it's not a cost to the system, right? And we can keep our kids in school and keep them in a mask optional state, and I'm all for it, right? I'm all for it. I am going to caveat this, and I have a pediatrician in one of our family practice. Well, she does family medicine, and so sees all age groups. We vetted this document with all of the administrators for all of the school systems. We vetted it with the hospital facility and medical leaderships for both facilities. We vetted this with the community health centers. We've vetted it with the entire health call, which includes both hospitals, community health center, health department, PSU, EMS, Southeast Kansas urgent care, and long-term care facilities, right? And we vetted it with the pediatricians. Now the pediatricians are looking for that, well, obviously that age group, the 0 to 17. They are in agreement-ish with this document, but their recommendation is that because we don't have vaccination for the elementary school, the under 12, that category should stay in universal masking until we do have vaccination. Now, I know that's going to be a hard pill to swallow. That's going to be a hard recommendation to take. And I think I and they understand if you move away from that and just follow the benchmarking, because we're doing so much looking into the schools by each, that it's a somewhat palatable alternative, but they would you can see her face. They would prefer that the elementary schools stay in. Now, there was one thing brought up that I agree with, and I'll tell you right now, I agree with. Kids don't get as sick from COVID as adults do. But I will tell you, it's wrong to think that they don't have any long-term problems from COVID, right? There's a few studies out. I've got one right here that talks about long-term effects of COVID in students. And actually, this is related to myocarditis or heart swelling, right? That a lot of people are having problems with the vaccine, right? They look at the virus data, the variants or the adverse events for vaccination and say, look, there's 100,000 variances with the vaccine. And then they attribute that to myocarditis. But I pulled the Kansas data, we had 11. And actually, a couple of those were double counted, right? The studies look at COVID infection for kids versus the rate of incident for adverse effects, specifically with myocarditis and cardiomyopathy, the swelling of the heart. Kids, for vaccination, 0.00004%, 0.00048%. The data for kids for effects after COVID, 3 to 30%, right? So even if we go to the 3%, right? 3% of the cases of kids with COVID will develop adverse effects with the heart. 100,000 times more likely, 100,000 times more likely to have an adverse effect from COVID than the vaccine. 100,000 times more likely. That's in the data, right? And then we haven't even talked about long COVID, although some of that was discussed earlier today, right? Long COVID can have long-term fatigue, shortness of breath, right? Long-term lung issues, long-term cardiac issues. It's taken more kids out of college athletics than anything else because of cardiomyopathy, right? You don't have to get a heart exam after vaccination, but if you're in college athletics, you do, and actually high school athletics, right? If you have COVID, you have to have a return to play. You have to have a physical to prove you don't have the cardiomyopathy before you can return to play, right? And so there's long-term effects there that aren't being stated, not death, but illness and injury, and devastating effects for those people for a long time, right? And we need to try to prevent that. But the other problem that we have with these kids is they don't live in isolation. They all have tentacles to family members, right? Risky family members that go on to get ill or die. The youngest one I've seen is 29, not the youngest death in the United States, but the youngest one here, 29, right? Dead, not a dad anymore, right? Not a brother, not a husband, dead. Tentacle, right? And so we have to understand that it's a lot more than just these kids. It's the community. And the other thing is, it's not just the high school or the elementary school that's doing masking, right? It's not just the schools. All of the medical entities are doing masking. PSU is doing masking. The city of Pittsburgh is doing masking. If you go into any of the major chain stores, all of their employees are masked. If you go to most of the restaurants, especially the major chain restaurants, the employees are masked, right? That's to protect them in the community. Now, they're doing it based on the same recommendations, not mandates. They're doing it for recommendations to protect their business, their employees, and the community that they serve. And I'm hopeful that we're going to be out of that soon, right? But we're all doing it for the same reason. But again, for the kids, tentacles, right? They all go home to family members. Mothers, fathers, grandparents, uncles, aunts, other community members. And so from a health officer perspective, when we're dealing with public health and safety, that's where our recommendations come from, right? I do find, or I do believe, that we are moving to a point pretty quick over the next several weeks that we will achieve the benchmarks for the mask optional state. And quite frankly, I think once we get there, because we have in Crawford County, much more slow than our counties north, south, east, and well, west. We have great vaccination rate. Add on to that the immunity rate from those that have been previously infected. That's starting to get a pretty good number for immunity within the community. And so I think once we move through this, we'll be in a better state. We're still getting vaccine going. I still encourage that. I think we as the health department stand ready to serve you with that, and all of our medical community. You know, we need to keep that going, but I think we're getting into a better spot that I'm hopeful that we will be out of this junk, because nobody likes it. I don't like COVID. She don't like COVID. I can tell you, the doctors, nurses, and all the staff that we work with in our hospitals and clinics, they don't like COVID. We want this gone, we want the mask on just as much as you do. I can tell you that 100% certainty, right? But we have the position that we have to give guidance based on the medical understanding that we know. And these are effective. They are effective.
I think that's the crux of the whole thing.
Sure.
Am I allowed to ask a question?
Please.
It's, well, I mean, this was just information for our board. You're here to just listen and. I don't
Okay,
think
so we're
we're
not,
open-
I just have a
I don't
question
think
for
we're
Dr.
opening
Stebbins.
it up.
Am I allowed or not?
Not at this time.
Okay.
So I was going to ask, because that's their.
Yeah, he said we could ask questions, so I just had a question.
He's got to go in front of us first. That's the whole problem. They don't think it works. They aren't wearing them right. That's our problem.
Sure.
We're trying to do the best we can with the information that we have. And with my experience, because I substitute teach also.
Yeah. So,
You know, it just puts us in a really, no matter what we decide or what we recommend,
yeah.
we're gonna make some people mad.
Right.
Either side of the.
And I will tell you, our voicemail boxes and inboxes and however where people can communicate with us are full from both sides as well, right? The pediatricians in June came to me. They started to work through the you know, they sent you the letter.
Right.
Right? And said, we need to universally mask in schools. These are our concerns. Well laid out. I did not sign that, right? Now, that's not because I don't necessarily believe what they were saying, but we were looking at the data, and in June, our data was much different than where we are right now. So in June, we had, when they first brought it to me, we had, at the end of June, we had 9 cases, 5:30 to 6:05. Second week of June, 22 cases. Third week of June, 27 cases. So I hadn't signed out on that because, like, I get it, but we got to sell it, and we have to have the data behind it. And it wasn't until July when our case numbers went to the 50s, 90, and then July 11th through 17th, we had 167 new cases, right? And that was Delta. And surveillance said all of it was Delta, right? All of the tested ones were Delta. That was the only variant that we were seeing. And that gave us data to come to you and say, hey, we have a problem, right? And so we're facing that too, right? We have a much more conservative sector. You've seen the other side on a few of our physicians in the community. And we're trying to present the data that we see here, so you can make the decision locally about what's going on. And then that's when we developed, it was then that we developed our recommendation document. And you'll see in the document, the initial document, we put out American Academy of Family Practice, American Academy of Pediatrics, CDC, KDHE, our local pediatricians, the Kansas Hospital Association, the school, Department of Education. KSHA had a little quiet this year, but they all put out information recommending this, right? And I said in that document, if I was them, I would do the same thing, because they're looking at the population as a whole. They don't know Crawford County, they don't know Girard. They don't know what your vaccination rate is, they don't know what your immunity rate is, they don't know how many kids you have, they don't know what your medical capability is, they don't know what your transfer capability is. They know nothing about you, right? And in the absence of any information about you, they're gonna do the most conservative, most protective approach. And I agree with that 100%. When you're looking at population health, that's how you do it, right? The difference is we use the data that we have here. We know your vaccination rate. We know our medical capacity. We know our communities. We live here, right? I live in Crawford County and have for 11 years. I graduated high school in Lamar. This is my home, this is my area. My mom lives here, my dad lives here, my brother lives in Liberal. I don't hold that against him. This is where I live. This is where my best friends are, where my family is. This is where I live. This is our community. We know you, right? And so we can use the data from here to recommend to you based on what's going on here with all of those other requirements. And that's what we brought forward to you. But that's also what we brought forward to you with the benchmark. So we can apply a modicum of safety and common sense and keep you in school, and also when we don't need these, get you out of them, right? All of us. Now, these are our recommendations. The studies that were brought up earlier tonight, the Denmark study is often quoted for masking. I have 20 more studies here. Hendrick study, that was actually out of Springfield. It's a great study. Local hairdressers, 2 of them came up COVID positive, seen 69 patients, universal masking, 0 cases of COVID. Right there together. I don't go to a hairdresser, but I know you get close, right? The pain study, masking reduced infection by 70%. The Wang study, masking reduced secondary infection by 79%, right? I've got 18 studies right here, right, that prove in those studies that masking is effective, right? And when we talk about types of masks, I've put out to all the administrators that we just follow the CDC criteria for mask, and that's the cloth or the paper mask like some of you are wearing. They have to have a specific requirement. It's on the CDC website. Because those masks, we know, can be 70% effective in capturing droplets that come out of our mouth.
You can't blow out a candle with your mask on, I know that.
Yeah.
In the little study.
Well, thank you for that. We'll add it to the book. And so the 10% thing that comes out, it turns out that the COVID virus fragment that is used to transmit is about 10 microns in size. And these masks won't catch many, just in isolation, 10 micron fragments. But we've all coughed. If you got glasses, you get to see it personally, right? You've coughed, you've sneezed, you see what comes out, right? You can see it. You cannot see a 10 micron fragment. And so most of that is caught in your mask, which is good. It's not 100%. Again, no 100% in human. But 70% at least. And that doesn't take into account the hydrophilic forces, the electrostatic forces. And if you ever look at a glass of water, right, you'll see how the water kind of turns up on the end, right? That meniscus sign, or meniscus that we call it. That's electricity pulling that water to the glass. It's sticking to the glass. Those droplets do the same thing in the mask. And so that catches some more, right? And we know from our data last year in the schools, which we were able to utilize to help us significantly reduce quarantine, right? That when the kids were masked and sitting together, and if we had a positive case, we were doing everybody within 6 feet, and the teachers were running around with 6 feet yardstick, 6 feet sticks to figure out where kids were sitting, and we were quarantining. And October, we put out the document. When was that? I think, October 16th. We looked at all of the infections in schools and seen if we had any transmissibility or in-school transmissions. And we had a couple teachers sitting around the break room, right? Highly transmissible state. we had several infections from that. Kindergarten teacher, working very close with a kindergartner and a third grader. Same thing. And actually, the third grader were kids playing, but they may have played after school. So, but we counted it just to add it in. That being said, of the other 92 cases, we had really no other in-school transmissions. And so what we did with that data is we stopped quarantining everybody, right? Now, we did that in the junior high and high school. We didn't include the elementary schools. But this year, using the same similar data, we're doing that in the elementary schools to minimize impact for kids and families in schools. So you can keep them in person and learning, right? And we have found that we've had lower transmission in schools, although, and that includes here, we have had some in-school transmissions because Delta is a beast. It's much more transmissible. But we watch each one of those case by case. We work very closely with the schools to minimize the impact and try to figure out any other places that we can play to minimize that impact. And I think we have a great relationship with all the administrators and the nurses in the schools to help manage those cases and kids. So, and we'll continue to do that. Okay. I don't have a lot else, but we are here for you for questions and happy to answer anything that the board may have with regard to this, and to continue to offer our support in helping the systems.
How long have you been in this role?
The health officer, I started June 19th of last year.
Thank you for your service over the last year. I know it's been no fun for anybody, and difficult to determine where to obtain information, what to look for. So we've relied heavily on you for that. I appreciate that you've mentioned several times. What's been really important to me is looking at our local public health information and local data. And I know you've had to spend the last year of your life looking at the complexities of COVID in ways that none of us ever wanted to, and I bet you didn't really volunteer for that job. But I appreciate what you shared with us. I appreciate that there's a path. I appreciate that you're not suggesting that we are going to be wearing masks for the duration of our kids' schooling, and that we're looking for ways to get back to that sense of normalcy that I think everybody's been seeking. And I appreciate the other points that you made about the medical community and the number of individual medical professionals who signed and provided information to us in support of universal masking for our students, and that's why we have the policy in place that we do. I know we have one physician in the county in opposition, but having to weigh all of that and all of the complexities and all of the issues that have to do with COVID and how it impacts our community, I appreciate what you have shared with us, and I hope that this community doesn't lose sight of the value that we've always had to look after one another and take care of each other. And I just pray that wearing masks in schools will not tear that apart. But I want to thank you for over a year of difficult service, and I appreciate what you shared with us tonight.
Appreciate that.
I think you answered my questions very well. Thank you.
Dr. Stubbins, I don't know if, I know you study the Crawford County data, so I don't expect you to be an expert in any other county. But I do know that, with the counties around us, there's been some comparison. Why are we in masks in the county next to us, regardless of what
Right.
proximity may not be? And in some cases, it appears that there are fewer cases. How would you direct our board in addressing those statements?
I will tell you, we've heard that and we're trying to verify that. And what we're getting is a lack of information, meaning they're not giving us the information. And the lack of information for some is turning into that there's no cases. But what we do know through some of the medical entities is that there is a test to stay strategy, which means there's a high-risk contact, which means there's a positive case somewhere, which means that it can't be zero, right? And so I am going to petition to the new Kansas work group for safety of kids in schools, for Dr. Jennifer Bacani and Dr. Norman, to have us add in a format that we can get to in the health department, the data for what school systems are actually seeing. And here's why. Because if it is absolutely true that all of these other school systems are not having cases, then we need to look at that, right? But what we're getting is not that, right? I got half a dozen news stories locally for many of these surrounding areas that have outbreaks, but that's not what's getting reported to you, right? One of our counties, not far from here, within an hour, I don't know if you play them or not, but within an hour, had over 100 cases within the first 2 weeks of school and another couple hundred of kids on quarantine that they were trying to test daily. You know, resources that.
167. They were trying to test 167 kids.
Yeah. And they were mask optional. Now we have 6,500 kids in our system and another 1,000 staff. And we have 32 cases right now, right? Or no, not 32, 37. So 7,500, that population, 37 cases, right? The other system was around 1,800, over 100 cases, plus another almost 200 in quarantine within the first 2 weeks of mask optional. So the Catholic charity, or the Catholic school system, they were considering whether they were gonna do this or not. That was another one that may have been brought to you, right? And we spoke with them directly as well and gave them this data. And they looked at it and they made a change, but they made a change when one of their systems almost had to shut down because they had so many cases within a week. I mean, it just decimated their school with illnesses, right? And so they went through a whole wave of, no, we're gonna mask. And now they have a similar product that they're gonna utilize for mask optional, right? So I know there's cases of schools that maybe don't have cases or maybe are not reporting cases. But they also may have a much lower incident within their town or community, right? And so the Danish mask study was done in April through June of last year and utilized masking, 3 hours of masking when you left the house to see if it was effective, right? But low incidence in the community. The entire community was on lockdown and it was all self-reported data, positives and mask wearing, right? But that's one of the mask studies that's being presented to us as a reason to not mask. And so I bring that up because if there's no cases in the community, you're not gonna get sick, right? That only makes sense. And so you have to look at the whole picture. And so that's why I'm gonna request from KDHE and that Kansas School Work Group, Kansas School Safety Work Group, that they request that data. Or see if they can get the data, maybe even blind, so we can utilize it to help make decisions, right? That being said, I think within 3 weeks, we're gonna be in a much better space. With the current trajectory, now, I can't say that, I have no crystal ball. But with the current trajectory, I think we're gonna be in a mask optional state anyway.
When do you think that's gonna be?
So
Currently, we have October 1 on paper, so.
currently, October 1 was a hard reset to reevaluate and re-recommend. We'll use the benchmark data based on that day to see. The hard part that we need is the 2 weeks trend, right? And so if for some reason, well, and this week, we're at 37 this week, so we're already going to exceed the 40 cases. We're probably gonna end up around 80. Historically, when we go from 150 to 100 to 80, the next week is below 40, right? I mean, that's, of our previous spikes, that's how it's happened. I'm hoping that that's what'll happen. So we have one little challenge because we have the bump because of Labor Day. So we need to see how that's gonna play out. That may offset us a week. A little spike up, but then I'm hopeful that we're gonna come down after that. Now that's using historical data, and so maybe the second week of October.
And where did we get the 40 number again?
So the 40 is 100 per 100,000 cases, and that's off the navigating change document for the yellow category. So that's the 51 to 100 new cases per 100,000. And so we wanted to be realistic in our approach for the numbers. And really, when we looked at the historical data for cases in the county, when we achieved that, we stayed, I mean, as we came down, we stayed down. And there's not like a 50 to 100 that we stay in a lot. We kind of hit the 100, maybe an 80, and then we drop below, and then we stay in that rate. And so it's also historically, when we look back, and for the hospitals, it was a better state for them too, right? And that's the other important piece. And so that's why we chose those together, because they work, those two have a tendency to work together well. And it really does, it's a good indication of what's happening in the community and where we're going, so. And for us, we had to come up with, you know, a realistic recommendation with some safety margin. And so we followed the navigating change document.
What if we're just knocking that out of the park on category 2, 3, and 4, and we're 42 cases?
So, and I think you can attest to this. If we will work with the schools versus trying to talk you into going into universal masking for the whole community. We may see, is it maybe one school had an outbreak and that's what rose that number up? And then we can control it with the category 4 in the specific school system, right? If that's what the issue is. If we are seeing a true rise in the county, we'll talk about that as well. But I think that's part of the communication piece that you need from us to explain what we're seeing, right? So now, if it's 50 or 60 or 70, I mean, this is, we're going to recommend, right? I mean, we're going to follow that. But we'll use common sense as we always have.
If you look at our case right now, we've got 13 positive in isolation. We've had 59. Now this goes back to July 1, even before this is like our budget school year. Ours is a little bit higher than the rest of the county.
Yep.
Why is that?
Well, you had 2 in-school transmissions, which didn't help. And then, you know, I don't know. I mean, I will tell you, a majority of the cases for school kids getting ill is from home. A majority, so.
That was a little bit of a rhetorical question. I
Yeah.
think that what we saw is, last year, to my knowledge, we never had an in-school transmission.
You did not?
You did not.
This year, we have had some,
Yes, you have.
and we know exactly where they happened,
Mhm.
and there weren't masks on. It was during lunch hour, it was during a shared water bottle, and, and we had a,
Yeah, it turns out when you share a water bottle and you have COVID, it transmits quite well. So, two things on yours, just as you said, you had a bit of an in-school transmission, and you have a community rate that's a little higher with the home transmissions. So, hopefully that will continue to decline. Unfortunately, Girard has actually led the way in cases essentially through the year. In the school, anyway.
Do we have any other questions?
I do want to say, just real quickly, and we don't always agree. We've had some debates on other things, but one thing I do appreciate is they are very accessible. I've talked to Dr. Stebbins, he's called me when he's in between emergency room shifts on a Saturday or Sunday, and we've called some people at County Health as late as 10 o'clock one night because we had an incident we need some guidance on. And very much, we do appreciate that very much.
We, I've done essentially all the speaking, I guess.
That's okay. Quite all right.
We both can say, or I can speak for her, we are here to support the school administration and boards and their decisions and the community to manage the patients, and we'll continue to do that. And this is hard for all of us.
This has been a tough, almost 2 years on everybody.
Thank you.
Thank you, thank you.
Appreciate it.
Thank you.
Thank you.
Need something else, let us know.
Item 14, approval to exempt students who have exceeded the 40-hour limit for remote learning due to quarantine or isolation from COVID-19.
As we talked about the last meeting, as per House Bill 2134 that was passed last spring, a school could not exceed 40 hours of remote learning for a student. The only course of action we have is the board can approve an exemption based on extraordinary circumstances or medical. And we have a list of students that have exceeded 40 hours where we're able to deliver some type of instruction back home. Have either been in isolation or quarantine. So what happens here is I'm going to ask you to approve that exemption. And Becky, you have documents you need to sign, and we will then, I'm not sure what the process is to send to the state board. They're still working on that. Then the State Board of Education has to be notified as well. So you have a list of students, and on that list of students, there's a student name, there's why they've had to be in the extensive remote learning. It has a begin date when they left school and the end date when they came back to school, and the total number of hours that they've been in remote learning.
Have a motion to approve the exempt students who have exceeded the 40-hour limit.
So moved.
Moved by Dave. Second by Roger. All in favor? Aye. Pose same sign. Motion approved. Item agenda 15, USD 248, 2021 student enrollment update.
In lieu of the length of the meeting and to give a better number, I think I'm going to punt that. It's about stable what it was last year, but we'll wait until the next board meeting. Facility construction is the first time for a while. We really don't have anything big going on, so I don't have anything to report there.
Okay, so item 17, executive session for discussions of meet and confer. How long do we need and who needs to attend? 5 minutes, and we need board and all administrators, please.
So moved.
Moved by Dave, second by Kelly, all in favor? Aye. Opposed, same sign. It's 9:04, 9:05, 5 minutes. We'll come back at 9:10. Moved by Dave, second by Peggy, all in favor, aye. Opposed, same sign, motion carried. Item agenda number 20, employment.
We have Girard High School Assistant Girls Golf Coach Jeff McDonald, that's a number issue. In addition to the agenda, was Girard Middle School Volleyball Coach is B. Katrina Brody, who's a high school physical education teacher.
Have a motion?
So moved.
Moved by Peggy,
Second.
second by Kelly, all in favor, aye.
Aye.
Opposed, same sign. Motion carried. Principal report. Anybody?
Read it.
Hey,
We all-
if you see Matt Logan, thank him. That's
Yes.
a team player right there. And he walked in and did, I mean, didn't have to and he did. And he loved doing it.
Band director.
He was, and he went down and he worked with them in the band room and out. I mean, he that's a team player. That's what we all want.
Absolutely. Even me.
We have a video of that.
We got pictures. I'm sure there's video out there. He's pretty talented musically, actually.
You have anything? No. Roger, Southeast
Oh, me, that's
637.
me.
Oh, sorry. Peggy.
Yeah, we had a pretty short meeting. They talked about the remote learning thing just like us and the additional funding for the testing and then, of course, the continued staff shortages, and that was the highlight of it. They really need paras.
On the Greenbush report, I did have a pretty extensive report on Family Connect modules that will be available, but I am going to punt that until next month. So we'll talk about that next month. Item, no additions, we're done with additions. Okay.
Motion to
Motion to
adjourn.
adjourn. Dave?
Second.
Second Peggy, all in favor, aye?
Aye.
Pose same sign. Thank you, everyone, for your time.
So patron comments were done. We didn't
No, they haven't.
get to say what we needed.
Thank you, see you.
Yep, we'll be back on next month.